Good afternoon. We're here with Dr. Harold Meinzer of Evolution Wellness in Vancouver and Langley, and we're going to talk about instrument spinal adjustments as a new alternative way of doing manipulation of the spine. How are you doing today, Dr. Harold?
I'm doing fantastic, and I'm excited to talk about sort of some different ways that we can still adjust people without having that sort of cracking, popping sound that some people are very fearful of. So we can maybe put at rest a few of those scared patients and get them in the office.
So how did this evolve? Why would this have been required?
Well, I think everybody's nervous system is a little bit different, and some people are very sensitive to change. And so these sort of higher velocity adjustments that I'm using my hands with, most people can tolerate it and do really, really well with those treatments. But other people, that's just too much change for their body, and that can aggravate or even stir up some of those symptoms. And there's, I guess, a percentage of the population that's going to have maybe some other types of underlying problems, such as osteoporosis, where we can't do those types of adjustments with. Some people might have fibromyalgia or other very, very pain sensitive or chronic pain syndromes that you can't change that much. And that information into the nervous system is too much and it just would flare things up. So I think out of that population came, we need a different way to treat. And so soft tissue work is great, but how else could we treat the spine and still adjust the spine in a very quick and efficient way that's not going to sort of stir up underlying conditions?
All right, and there's a lot of research, I'm sure, that's gone into this as to the effectiveness and how it works and how to use it to get great results with people.
Yeah, there's the instrument that I'm using, the Impulse, that's out of Neuromechanical. It's out of Arizona. They've done, a decade plus worth of work doing research both in university settings here in North America and in Europe. And so they've done a lot of clinical research on sort of how the settings work and how it affects the spine, how it affects the nerve, and what centers going up into the brain is being affected by it. So that's one of the reasons I like using that specific model. There's a number of different ones out there. Today we're just going to talk about sort of my favorite one.
So how does it work? What does this thing look like?
Yeah, it's a great question. So it looks like something out of Star Trek. It's a little handheld instrument, and it has different styluses that we can utilize depending on where in the spine we're treating. And so it's a very, very slick instrument. It has 3 different force settings so that we can kind of like a very low impulse, medium, and a high, depending again on where the spine or where in the body we're using it. And we're not just going to use it on the spine. We can use it on wrists and elbows and shoulders and knees, all different extremities as well as the spine. And so this specific one, you might be able to see on the screen. This fires a repetitive force. And you can hear all these clicking. So the thing about this specific instrument, it is set at 6 impulses per second. So it's really, really fast, and it's faster than our body can sort of muscle guard or tighten up. And so that's one of the reasons I like to use it so much. And all these sort of instruments, they're working on speed rather than force. So when I use my hands, I can only use my hand or move my hand so fast, where this is going to be 100 times faster than what my hand can move. So it's a pretty slick-looking instrument, and it's pain-free. You're not going to feel any pain while you're getting adjusted. Some of the spots, if they're tender, you're going to feel some tenderness, but generally it's a very pain-free way to treat or adjust the patient. And then with these different styluses, we can kind of get onto the spine in different ways. So the way our spine, we have these wonderful facet joints that function in the back. And so what we use the instrument with is to come up and through the spine and along the facet joint to shift and move that joint. And really, we just want to create mobility. And that's what we do with manual adjustments, is that we take a fixated joint, something that's stuck and not working, and we shift it over and create mobility in it. And so rather than one big force, we're going to use small repetitive forces to shift and open up that joint space. So sometimes I say to patients, it's like you have a destination and you can take one road to get there, you can take another road to get there, but you're going to get there in the same way.
Yeah, the end result is the same, but perhaps even faster. Is that kind of another benefit of using this?
I think for some patients it will be faster just because the manual manipulation is just it's just too forceful for them. So they're not going to get the benefit as quickly. With this instrument, it can mildly move and shift that joint, and then in a very progressive way, you don't stir anything up, and patients will get better. And so with these instruments, because that's run on a computer chip, the one of the great things is that now we get consistency of treatment. So each force is going to be exactly the same when I use it today on Monday or Friday or next week or in a month. So each time it's very reproducible. With other instruments that are out there, they're spring loaded, so those springs and things will degrade over time. That's one of the reasons I like this. It's run by a computer chip, so it's going to be exact every single time that I treat you. Or if I'm not in the office, my older brother's here, then he's using it on you the same way, and you're getting the same treatment.
And I'm sure that is a difference compared to manual manipulation, where it's pretty much impossible to have it exactly the same every time.
Yeah, it's true. And you try as a practitioner to try to have that same amount of velocity and thrust for each patient, but every day is different, really, right? Within the patient's body and then within the practitioner as well. So I think that's one of the great things about these type of instruments is just the consistency of treatment. And also with it, we can be very specific, right? So depending on what joint, where it is, what angle, how the body's situated, the curves of the spine, like all these things to take into consideration, then we can be very specific at the angle at which we adjust and move things. So I also like that for some patients and in extremities as well. It works very, very well for extremities. And I kind of touched on sort of the safety of it, with light force, and that's sort of one of the biggest things in the office is I always get patients saying, I don't want you to crack my back, I don't want you to crack my body, and so this is a very, very effective way that we can still treat the entire spine, body, neck, and be compliant with the patient's wishes as well.
So extremely safe, and so it's good for people with osteoarthritis, or you mentioned, or elderly patients.
Yeah, those are some of the ones I for sure use it. Osteoporosis is another one where you can't really load a joint or put a lot of pressure into it for risk of fracture. So elderly, and then I have some patients in wheelchairs that they can't get onto a table, and so I still need to treat them. So I can use that in different positions. So I have patients come in the office with disc problems that can't get on the table. So at least I can treat them. I can treat them standing, sitting, in a side position, and I can change things around just because the instrument gives me that flexibility. So it's really effective that way.
So basically, to sum it up a little bit, then it's really consistent force. It gives you an easy way to move past the patient's body, kind of natural resistance to being adjusted. And
Yeah,
as well, it gives you that kind of narrows in a little bit more specifically to the right angle and direction to apply an adjustment so that you get better results. Sometimes it's very safe, it's versatile.
yeah.
Geez, well, how come everybody isn't using it?
That's a good question. I really enjoy using it, and I see a lot of patient referrals that come see me just because I'm using that instrument. They don't want to be manipulated. And for some patients, I'll use that in the neck because, truthfully, that's the most fearful thing with patients is they're scared about neck adjustments. So we'll use that with the neck, and I can do other type of manipulation on the rest of their body they're fine with. So it could be a combination. It could be a little bit of this, a little bit of that. It just gives me more versatility in treating people and different problems as well, right? So I find it like another tool in my tool belt to help patients out, to get them out of pain and get them back functioning again.
So there you go. If you're looking for really safe adjustments, the guy to see is Dr. Harold Meinzer. You can reach him at Evolution Wellness in Vancouver, and in Langley, you can reach them at 604-881-2404 to book your appointment. And you have to book ahead. He's always busy. He's a popular guy, and he's an exceptionally good chiropractor, my chiropractor. And thanks so much, Harold.
Yeah, thanks so much for having me. It's great talk again.